We designed this event to be a coming together moment, an opportunity to pause, think, reflect on everything that this year has taught us. And as I stand here today, the COVID-19 pandemic is not over. Many of you are still facing its threat each and every day, but we also have an opportunity to learn from what we've experienced thus far and to use these insights to inform the next few months and perhaps even position the industry for something entirely different.
Health inequities have been laid bare. And again, I think the bright spot is the conversations around these health inequities haven't just been, although this is important, whether or not you have affordable, meaningful health insurance, whether or not you live in an area that has a good health infrastructure, how close you live to doctors and hospitals and other services. Important, but I think people are talking about the fact that transportation is an issue and that a majority of the folks who have died tragically from COVID are Black and brown, and that is because they're in these jobs that are essential jobs, didn't have the privilege of working from home, often lived in denser communities in certain communities, and then that has us go back to why. And again, which is, I think, is important. And earlier I talked about structural racism and policies and practices. So I think all of these absolutely have been laid bare.
So what do we know about these high-risk patients, those of them who have one or more of these chronic conditions? Well, we know that they're older. 83% of them are above the age of 40. We also know that they are more likely than low-risk patients to live in low-income areas. But that's not all that we were able to see in the data. At roughly the same time that we were starting our analysis of high-risk patients, the national attention turned to a collective focus on race, social justice, and the inequities faced by people of color. And we realized that we had a unique lens on how all of these issues, COVID-19, chronic disease, access to care, how they all present themselves in many cases together. So as you can see on the far right of this slide, high-risk conditions affect patients of color disproportionately. 14% of high-risk patients are Black versus 11% of low-risk patients, which of course turns out to be only part of the story of the impact that COVID-19 has had on communities of color. So while high-risk patients as a group are, not surprisingly, almost twice as likely to be diagnosed with COVID-19, that's what you see in the bar charts over on the left-hand side of the slide, high-risk Black patients are 2.2 times more likely to have a COVID diagnosis than high-risk white patients. And high-risk Hispanic or Latino patients are almost 4 times more likely than high-risk white patients to receive that diagnosis. And then when you look at the absolute extremes, when you compare high-risk Hispanic and Latino patients with low-risk white patients, the high-risk Hispanic or Latino patient is 5 times more likely to have received a COVID diagnosis. So what do we do with this? These are, of course, extraordinarily complex, nuanced issues, and there are many, many talented academic researchers who have devoted their entire careers to understanding these types of patterns. But we did want to offer some thoughts on how providers on the front line might use insights like these.
What's underneath that speed is the quality of partnership that went on between technology companies and providers, between providers and patients, where the communication was unprecedented. Constant updates of these are our new safety protocols. Here's what you need to know. It was amazing. They did it through us. They did it through Athena. You know, it was amazing to see that level of very thoughtful communication, which healthcare isn't known for.
As I mentioned before, providers have realized the power of virtual care, and patients love these things, and they all realized how well this works together. So we are seeing innovation on steroids, and our responsibility as vendors is that we keep focused on really delivering high volume, robust solutions, because this is not going to be for 10 patients, it's going to be for full patient panel eventually. And so that's something that we'll see a lot of going on. But what I think will happen in the next maybe 18 to 24 months, is that we'll see provider organizations brand themselves based upon their virtual care capabilities. So it will be all about how well are they doing and how well are they taking care of their patients virtually, and they will brand themselves not only towards patients, but also towards payers, because it will allow them to go and get better contracts, and it will be something that payers and employers will require.
I think that that's really going to accelerate innovation in longer term. As we come out of this pandemic and get out of the acute phase of the situation, I do think we're going to take lessons that we learned, techniques that we learned. You mentioned how fast we got our telehealth product out, kind of unprecedented new product release in a very short period of time. And we did that obviously differently than we would normally have approached that problem. And that taught us a lot internally. So I really do think that this has positioned us as a company and the healthcare industry overall to kind of innovate in different ways and innovate more rapidly than we have in the past.
Pre-COVID, we thought we did a really good job of getting those well visits in. We used the automated campaigns, we ran our reports, we had a lot of systems in place to make sure we had our appointment reminders in place. So we had, I think, about an 87% success rate with well visits, and that includes the adolescents, who are the hardest to get in. And we realized during COVID, we needed to do just as well, if not better.
One of the first things we did in the pivot at the beginning of this pandemic was utilize not only data from Athena, but other data we have in our technology platform called DocOS to do a risk stratification in addition to our normal proprietary Medicare risk assessment. We did a specific one tied to COVID from World Health Organization data from results in China, and use that to identify a group of patients that we wanted to support and ideally keep in the home. And we had all hands on deck to mobilize and reach out to these people, ask them what support they needed, if they needed food delivered, other things to keep them out of risk. And that was really facilitated by the platform.
Strong, stable, mutually reinforcing connections that fuel powerful, creative, constructive human relationships. Healthcare has been and should always be a human-centered industry. Powered by technology, but always in service to connection. These concepts are the heart of our vision for athenahealth, to build a thriving ecosystem that delivers accessible, high-quality, and sustainable healthcare for all. And we can't do this alone. But in partnership with each of you, we will make this a reality.